The London Marathon is one of the biggest annual charity fundraisers in the UK, with runners raising around $80 million for good causes. But not this year. Like so many major events, it's been postponed due to a coronavirus lockdown. Charities are being hit hard at a time when they've been forced to shut their shops too.
We have this awful situation where income has gone down by roughly 50%. So the money that we need to sustain us has gone down. And at the same time, the need for the services that we provide has gone up.
With events cancelled and shops now closed, the main source of income for many charities has, well, dried up overnight. And this is beginning to have a knock-on effect on the services that they provide at a time when shelters, food banks and hospices are needed more than ever. The Sue Ryder Healthcare charity provides care for people with terminal illnesses and neurological conditions. Its care centres and staff are funded mainly by income from its 450 shops. They sell donated clothing, furniture and homeware, but all of them are currently closed. The charity is having to deal with a shortfall that may see some of them shutting for good.
Hospices are reliant really on their income from shops and from fundraising. That we only get approximately 30% funding across the sector for the services from government, and therefore the money that comes from the shops is often quite significant. And for Sue Ryder, it's added together with the fundraising, it comes to £6 million a month. So if we look at the next 3 months of the kind of crisis that we're living through, that's £18 million in Sue Ryder that we are trying to find a way of funding differently.
The irony is that hospices like Sue Ryder are crucial to support a national health service that's being pushed to breaking point by the spread of COVID-19.
Over the coming weeks, the need, sadly, for end-of-life services is only going to grow. So I think it's a time when the nation needs to be able to turn towards its hospice services and know that it can rely on it.
With such an income shortfall, there is now the very real prospect that some of these services will have to be cut back and some charities won't survive at all.
I think we will see some household name charities cease to exist. For some of them, even the ones that have got reserves, because of the way that those charities, they have fixed costs, they've already spent money on events and so on. Those reserves will only last a short amount of time.
Without immediate financial support, Sue Ryder says the critical end-of-life care it provides will soon come to an end. It's put out an emergency call to the British public to do their bit from home, even if they can't run a marathon or visit a shop for now. Matt Gooderick for TRT World, London.